From KETK, you're watching East Texas Live at 3.
Welcome back to East Texas Live. May is National Speech, Language, and Hearing Month, and Megan, a speech pathologist, is here to talk about what they do. Thank you so much for coming back to our show.
Absolutely. Thank you for having me. We're very excited. May is, like you said, National Speech, Language, and Hearing Month, which means we get to bring attention to what we do for a living, which is often really misunderstood. So speech pathologists, we treat the entire lifespan, so birth to death. So essentially what we do is, if we have a baby that's born and needs immediate help, if we have a premature baby, they're going to see a speech therapist in the NICU. If we have a kid who's having a hard time with articulation or phonology or they stutter, you're going to see a speech pathologist. And then the rest of the population we also get to work with. So I happen to be a medical speech language pathologist, and I work exclusively with the adult and aging populations, which means I get to work with some of our older individuals, somebody who's had a stroke, a traumatic brain injury, Parkinson's, gets diagnosed with something like ALS or MS. So we have the true pleasure to work with anybody at any time, almost anywhere.
Yes, and so, where can people find a speech therapist and speech pathologist?
I love that question. So, depending on who you are and what you need, you're going to see a speech pathologist in the hospital, and that's whether we're a young child or an adult. We're going to see a speech pathologist in the schools, and that's all the way through. So elementary, middle school, high school even. If we're in the adult population and we need to be in a skilled nursing facility for rehab, you're going to see a speech pathologist. You may, if we're healthy enough, but we have some stuff going on we need to address, you might see a speech pathologist in a private practice or in an outpatient setting. So if we are a child, we might go in and work on social pragmatics, like I said before, stuttering, anything where we're going to see a difference in developmental norms, we're going to go see a speech pathologist. And then same thing with our elderly patients or our aging patients. If something goes awry with voice, speech, language, swallowing, some respiratory function, you're going to come see us.
So you're saying, so whenever we have those type of symptoms, that's when we should reach out. So when should we find a speech pathologist?
Such a great question. So the wait and see method really isn't our friend. Now, don't get me wrong. As a child, there is a pretty big spectrum for normal when it comes to developmental regulation. So whether our words are coming in, our sounds are coming in, sometimes we see social differences. But as soon as we start to notice something deviate from typical for a month or two as a pediatric patient, we probably want to be calling our doctor and saying, hey, I'm noticing we're a little behind here and we're a little behind there. And for better peace of mind, I love the professionals. A physician or a medical person outside of a speech pathologist may say, just wait and see. But it is our job as the professionals to go in and evaluate the differences we may be seeing and then treat those. And so same thing for the adult population. Generally, if we're healthy enough, but we're noticing a difference maybe in our memory or our voice sounds hoarse or harsh or gurgly, that's when, if it's been a little bit more than 2 weeks, I will generally say, we're all allowed to have an off week, we're allowed to not feel good, we're allowed to get sick. But if we see dysfunction past a 2-week period, that is also when we're calling our physician and saying, hey, this is a lot harder than it used to be, or this is concerning. Can I get to a speech therapist? Yes. Now, the trick in East Texas is there are not a lot of us. So if your physician isn't aware of us, certainly there are lots of websites available that have our information, but a primary care, a neurologist, an ear, nose, and throat doctor, you'll also find us in those settings. All of those are great options for asking, hey, should I be seeing a speech therapist?
Yes, ma'am. Where can people get more information real fast?
Yeah, absolutely. Our website is ssnrtx.com. We're in East Texas. We're in Tyler specifically, and we're always happy to be an advocate.
Well, thank you so much for coming in and telling us all about that.
Absolutely. Thank you for having me.
Yes, ma'am. For more information, you can go to the website right here on your screen.